Hey everybody, Randy Kurtz here for the ISB with the tip and or stretch of the month, as it were. So this month I'd like to talk about something that can be somewhat attributed to technique, but many times will show up in things that we do or places we are in our everyday lives. Many times one will notice pain and or numbness or tingling in the fourth and fingers of either hand. On the right side, it's a little easier to attribute to technique in that bases are often in a flexed and ulnar deviated or off towards the pinky side position, which can cause a condition called ulnar tunnel, in which a nerve gets compressed here at the wrist and again will provoke pain and or numbness or tingling in that hand. That can happen on either side, more likely on the right if one is right-handed due to the playing position. But also one can notice either on the same arm or on the other arm, fourth or fifth fingers or both getting numb, and it's coming from the elbow area. So I'm seeing this quite a bit. This is called golfer's elbow or medial epicondylitis, and this can happen from technique, but is more likely happening to patients that I'm seeing, and again to myself, from sitting positions, meaning you sit in office chairs, you sit at your desk, you sit on airplanes, you sit anywhere where there's a chair with arms on it, and sometimes it's a wooden thing, and sometimes it's that hard plastic or metal, and sometimes it has some sort of a covering, and sometimes that covering has sort of warped around it. And what happens is we put our arm down, and our arm naturally wants to find a comfortable place. So what happens, it flattens out, and this little groove right here next to the elbow, which has been called the funny bone, even though nothing funny about it. You hit it and it hurts and it tingles. What happens is we lay our arms down, and that area tries to sort of find a natural place on that flat surface, and it gets in that notch, and that can compress that nerve. Well, you can see how that would cause problems after sitting like that for hours at a time. Again, most commonly at a desk or a workstation. Maybe you don't move your arms much, or on an airplane. That's where I'm noticing it quite a bit as well. So something to be aware of is if you find yourself in that position, try to put your arm sort of flat like so, and I've got my wrist sort of hanging down or towards the end of it, and I don't, the rest rather, and I don't have my elbow on that arm directly. What that elbow is sort of hanging off the back rather than, again, that groove finding its place on that rest and commonly causing that numbness or tingling in the fourth and fifth fingers. So keep that in mind, be aware of that, and shift as and when necessary, and that'll probably go a long way towards eliminating a lot of these problems. Technique, of course, is part of it, but this is also a big part which probably many aren't thinking about. So again, Randy Kurtz for the ISB, my book, The Basis Guide to Injury Management Prevention and Better Health, always available at my website, www.drkertz.com. Also available from your association, and please feel free to email me anytime, drkertz@drkertz.com, where you can also find on my website Skype lessons and all manner of other things. So happy holidays, and be seeing you soon. Thanks a lot. Bye-bye.